I'm Lisa Sheffy, physical therapist at the Nexus Neurospecialty Program. I get to work with patients and implement a rehab approach into an LTAC setting. I've been with Nexus for about 5 years plus, so we've really done a lot of program development during that time, and we've gotten to really focus on individualized care, and we're on the small side of a hospital, but that allows for a lot of accountability, teamwork, a lot of really good interdisciplinary care between nursing, wound care, all the different therapy disciplines, and being physician-led and being able to be a really important part of the team with the patient and their family has really been really rewarding for me.
I'm Michelle. I'm a speech-language pathologist, and I have been with Nexus Specialty Hospital for 3 years. We take patients that are anywhere from being in a near coma-like state, and we treat them if they have a trach, if they have swallowing problems. We start there with them. And in my role, I get to a lot of times see them start communicating or try to find a way to help them communicate, whether it be moving their eye, like one patient that we had. He was able to blink to communicate. So we try to find a way for patients to be able to express their needs to the caregivers that are taking care of them and their families.
I work with all of the therapists and the other members of the healthcare staff to identify the individual needs that patients have and an individual medical and therapeutic objectives that they're trying to reach, and bring them together in a more dynamic, loose-knit setting, I should say, where they're working with other people on tasks or skills that don't really seem like traditional therapy. They're playing a game, they're dancing, they're creating something from clay or sanding some wood, but it's all purposeful activity. It's all purposeful programming. What we're trying to do is build and carry over skills that happen one-on-one with the therapist, or working on things such as socialization, eye contact, memory recall, initiative, some of the more fine motor and gross motor with reaching or doing an activity and demonstrating a skill while standing. So what I do really dovetails with the skills and interventions that the other medical professionals are doing.
We all make a personal connection with the patients, and even from the patients that are near coma that really can't interact very well, we're really good at looking for the small changes that patients make and noticing the small little things that they might do. It might be as little as seeing them start to move a finger in response to us wanting them to do that. It may be as small as watching them track an object. Sometimes it's as small as that, but we get so much joy out of seeing those little things. I mean, I think we both can think of a patient recently who we got to have for 6 months and really see his progression, and he was very slow in his movements, but he came out of near coma and is now in a conscious state. So
And the team connected with him so much that it is almost a friendly competition between nursing and therapist. I saw this, did you see that? No, he didn't do that for me. Well, I got him to do this today. And so we find those good moments of those snapshots in time, and we put them together as a whole team. And then when patients are really doing well, we can really build off of that because our team works so closely together.